Afternoon, Bustmob, and happy Thursday. Today I'm going to be interviewing Dr. Fredman, who is our Amelia St. Louis surgeon, who happens to be visiting us in Raleigh today, so I'm super excited. I have a bunch of questions from you ladies that you wanted me to ask, so I'll make sure to get through those 10. But if you have questions throughout, just put them in here. We'll answer them as we go as well. So here we go right now, and we'll get started. So excited. So many questions. There we go. Hello.
How's it going?
All right. Let me get this out of the way. All right. How are you doing?
We're doing great. I'm so happy to be here back in North Carolina.
I bet. We've missed you so much. So it's so fun to see you around here.
I missed you guys too. It's great being here.
Good. Well, this is actually kind of funny because one of the questions it kind of relates to this scenario. So do you ever do surgery in Raleigh? That's one of the questions.
Oh, I wish I still did. No, I'm only in St. Louis. But of course, the team in Raleigh is amazing. Dr. Pyle, Dr. Routen, Dr. Hunter, and all the great people here. So if anybody is near Raleigh, they're in great hands.
That was like towards the end, but I'm like, well, since you're here, seems like a right answer.
Yeah.
All right. So we have everything from like breast implants to liposuction to tummy tucks to recovery, all the things. Greta Nance, Team Raleigh or Team St. Oh.
Of course.
This is going to be fun.
I was at UNC for years, so.
Oh, yeah? Oh, look, you have Raymond is getting a mommy makeover tomorrow.
Great. I'll be back.
You better hurry back.
Yeah.
All right. So here we go. So the first one, we're going to just start with breast implants because a lot of people in Bustmob ask about breast implants. So silicone or saline breast implants, which one is better and which one do you recommend?
So it's not necessarily that one is better, but they all have their pros and cons. Most people end up choosing a silicone implant for two main reasons. One is a silicone implant is designed to look and feel like breast tissue. They've improved drastically over the decades, and they do a great job of looking and feeling like breast tissue. A saline implant is a bag of water, and you can't do anything to water to really make it more like breast tissue. So that's the main reason that most people go with a silicone implant. Another thing to think about also is what would ever happen if the implant shell had a crack or hole in it, which is called a rupture. With a modern silicone implant, nothing happens. It's not dangerous. It doesn't leak out. It doesn't do anything. A saline implant is going to deflate. And that can be pretty inconvenient depending on when you can get in to get them replaced or what's going on in your life. So those are two things that lead most people to end up choosing a silicone implant.
I like to call those flat tires when you have one that deflates.
Yes. Right.
So I had saline implants for 10 years and recently switched to silicone in 2020. And they're definitely so much more soft. Like I felt like before they were kind of like grapefruits. I liked them as grapefruits, but now they're more squishy. So it's very more conducive to my lifestyle now because I like to do yoga. And laying on your stomach when you have overfilled saline implants does not feel good.
Yeah. I love when I get the chance to do an implant exchange from saline to silicone because I can reliably tell people I'm so excited for you to get to feel how different it is and I think better for most people.
I agree. So what are your thoughts on the ideal implant? Someone in here just said that they were going to get the ideal implant. And I know there's mixed opinions about the ideal implant. So what is yours?
Yeah, so first, Ideal is the name of the brand. And what that company tried to do is they tried to make a saline implant that felt like silicone. And it is a saline implant, but it has several layers of silicone shell in there, and that makes the saline flow through it in a way so it actually feels like a silicone implant, at least outside the body. So I generally don't use saline implants, and the reason that I don't in my practice is outside the body. I think they did a good job of making it feel pretty similar to a silicone implant, but I don't feel like that follows through when they're in the body. I don't think they're as natural appearing after breast augmentation. So I generally don't do them in my practice, but there certainly are practices out there that do them.
Let's see. I want to get a breast augmentation, not me. This girl says, I want to get a breast augmentation. I have my nipples pierced. Will I have to take them out?
We usually ask people to take them out before surgery, and they can go right back in after. So whether we're putting them back in or they're putting them back in, the reason being, during surgery, we try to not have things that are metal touching the body. It can potentially, this has never really been proven, but potentially interfere with some of the technology and devices we use during surgery. So usually we have people take out piercings before, and it can go back in right afterwards, but it doesn't need to stay out or anything.
What if they use like a plastic retainer?
Yeah, so plastic is fine. I've had patients that put a plastic retainer in. We still prep that, and then we cover it. And during a breast augmentation, either way, we put a protective cover over the nipple and areola during surgery. So it all is kind of staying away from the surgical field anyways.
That's cool. And so you can put them back in before they wake up.
I can try. Not always successful, but I'm happy to try.
All right. So what can you do for a double bubble? So this girl has a double bubble and she's 8 weeks post-op. Will it fix itself?
Okay. So first, what is a double bubble?
Yeah.
Have you seen the watermelon challenge where you put rubber bands around a watermelon?
Oh,
like
a long time ago.
Yeah. So that's kind of a good example of what can cause a double bubble. Basically, there's something constricting something. And because of that, there's a bubble above and a bubble below. So why does that happen to somebody's breast? And the reason that it may happen is that constricting band usually is the person's fold, because that's made from kind of strong fibers under the skin. And the bubble below that band is usually the implant, and the bubble above the band is usually a person's breast tissue. Now, a double bubble is not always really a complication. It doesn't always mean that something's gone wrong and something's going to need to be fixed. It may be expected if somebody has a very high fold, especially in something called tuberous breasts, or just in general, if somebody's fold is really high and the implant is, we know the implant's going to sit below there because there's not enough room for it to sit above, then sometimes they do have a bubble below that constricting band and then kind of fullness from their breast tissue. And that would be a situation where I would say that most likely it will improve over time. As everything relaxes and stretches out, that band kind of relaxes and things get better. Now, a double bubble could also happen because the implant is dropping below somebody's fold. That's bottoming out. That's not a good thing. And then that would be something that would need to be fixed and is probably not going to get better on its own.
Can you correct a double bubble with fat grafting?
So it depends what the cause is. So fat grafting is great at masking things, kind of covering things up. So if the goal is just to cover up that constricting band and add some fullness, great. You can do some fat grafting, put that in there, and that can help. But if the problem is that the implant is actually in the wrong position, then the solution is fix the position of the implant, and then you fix the double bubble.
Got it. That was a good question.
Yeah, great question.
All right, so is it hard for me to achieve side boob with a large rib flare? My implants fall inward.
So when I hear somebody describing their chest as rib flare and implants falling inward, I think that they might have a chest wall abnormality. So whether people know it or not, it's not so uncommon. There's something called pectus. Pectus excavatum is one of them, but basically where the sternum or their chest wall goes in, it's concave, and that can make somebody's ribs look like they're flared. And it can cause problems with the implants because the implants are not at a level surface. They're on a decline and they can fall inwards. So it may be that that's what's going on. Now, as far as having side cleavage, a lot of that has to do with choosing an implant that's the right width. But in this situation, if the implants are just falling in, that actually can be a reason to use a textured implant, which is going to stay in place a lot better than a smooth implant, which will fall in. So that's one of the few times that I will sometimes suggest a textured implant, because if you put a smooth implant in and it keeps falling in, you might need to do a lot of revisions to keep moving it back out. Got
it. So if you switch to the textured implant, would you put them over the muscle or under the muscle?
So I probably would keep them under the muscle. Under the muscle is a good place to be. And either way, the muscle can help the implants from going too close together. So, because again, it's not being switched to textured to prevent capsular contracture. But if they're already under the muscle, I would just keep them under the muscle.
That makes sense. All right. Is there anything I can do to help speed up the dropping and fluffing process?
I wish that would help a lot of people. There isn't anything that's really been proven to make a difference. You hear of people being told that they have to wear a band to push everything down. I myself will tell people sometimes, yeah, go ahead and try to massage it down towards your toes. I don't know if that makes a big difference. And it really is just time. And some people it takes longer than another. Sometimes one breast is different than the other. It's just a time process.
So someone asked a question similar to this about 30 minutes ago that I didn't add, but I wanted to ask because it kind of follows up with this question. She was wondering about dropping and fluffing. Does rapid recovery help with dropping and fluffing quicker?
Yeah, the idea of rapid recovery is we're going to do a bunch of things that help the muscles relax. So instead of keeping your arms at your side and everything gets tense and tight, we're going to have you stretching your arms. And you can massage your pec muscle and you can take a muscle relaxant. Is that going to help with the drop and fluff process? Maybe. It may help if it helps the muscle relax. Again, these aren't really things that are studied, and I have all my patients do rapid recovery, so I don't necessarily know what would happen if they didn't. And drop and fluff, and again, everyone's different and each breast is different, so it is a hard thing to study. I think logically it makes sense that it probably does help, because the more relaxed and looser the muscles are, the more they can drop.
Another girl asked, why would my friend drop faster than me? Like, what is it anatomically? Is it my chest muscles are tighter than hers, or like what's the reasoning behind someone maybe not having the Frankenboob high and tight look and someone else is like looks basically normal?
Yeah, it may be that one person's chest muscles are tighter than the other. I think that probably does play a role, but swelling is also a factor. Swelling contributes to that too. And why one person has more swelling than another is not something that I think anyone will ever know.
Got it. So it's just basically how the body responds to it. It's just
correct. Yeah. Yep. For sure.
What can I do to prevent disastrous lollipop lift scars? I am a very crappy slow healer.
So in general, what can be done to improve the scars and make sure they heal well? So there's factors related to somebody's health and giving your body a good environment to heal. By far, the most important thing is going to be not having any nicotine in your system. So no nicotine for at least 4 weeks before and at least 6 weeks after has been well researched. And that's going to make a big difference. Probably the most helpful thing, making sure that somebody has good nutrition, so you have all the building blocks that your body needs to heal. So that's something on the patient side of things. The surgical technique plays a role. Scars or incisions that are closed without a lot of tension on them tend to do better than when skin is being pulled really tight. So a lot of the technique that we use during surgery is aimed at all the lift, or with the tummy tuck, all the pulling down is all done on the deeper layers. So you're not relying on the skin to hold everything being pulled down, and then everything heals really well. And then there are things that you can do to the scar. We found that by keeping paper tape over the scars for 6 weeks really helps the scars do well. And then that's not the end of it. When that tape comes off, then we give them a scar salve, and we give them your scar salve. And and that helps a lot. And I tell my patients to put that on twice a day, massage their scars for the whole first year. And those are really helpful things. Also keeping things away from UV, so wearing sunscreen if anything's going to be exposed to the sun.
Yeah, definitely wear that SPF. The surgery one. Do you do surgery in Raleigh? We addressed that one. Any post-op recovery tips for bra line liposuction?
Liposuction is hard. It's recovery from liposuction is hard because you can't numb that whole area up, right? It's a kind of broad area. And even if you put numbing medicine in the solution that you inject before you do liposuction, because you always inject some solution before, it's out of your system pretty quickly. So within hours, it's gone. So it's a hard area to really control in that way. And people are sore after liposuction. And it's also something that just takes time. In general, compression is helpful after liposuction, both for comfort and for an end result. It can be a little bit of a challenging area to compress. We usually take something called lipofoam, just foam, and put it inside somebody's bra so it's pushing there. People get creative, whether it's a rolled up t-shirt or socks or something, but anything that you can do to add some compression helps. That's probably the best thing you can do.
I see Colleen asked if bra line lipo is included with the breast aug. It typically isn't, but it is for a lift. Is that right?
Correct. Yep. For a lift, if it's needed, then that's part of it. But for breast aug, it would be an additional area.
But it's worth it because I did it in 2020 with my breast implant exchange. I had a bra line liposuction and submental, best add-ons I could have done. Like, especially this. It just changes completely like the shape of your jaw. So yeah. Colleen, check out those things. And download Bustmob Academy too, because we answer a lot of those questions.
And when it's done during a breast aug, I do it through the same incision. So you don't need an extra scar for the bra line.
Nice. And last question, and I'll go back through because I saw that we missed a couple. This is kind of like a two-part question. This is for tummy tucks. So during a tummy tuck, do you use the old belly button or do you create a new one?
Okay, great question. You keep your own belly button, but it's not going to look like the same belly button because there ends up being a new opening for it. So it's your belly button attached to your abdominal wall. All the skin is pulled over it. And then, so if you picture all the skin being pulled over it, I have to make a new opening for it. And that new opening makes it look like a new belly button. So when you look at before and afters, it looks like, oh, that person has a new belly button. It's the same belly button they always had. It's on the same place in their body, but it looks totally different because what your eye actually notices is everything around it. Yeah.
So the next question for the belly button is, I have no idea. Do you use belly button sutures on the inside or outside?
Generally the inside. In general, most of the time I try to use stitches on the inside. I find that helps with the scar. The thing about stitches on the outside, so usually removable stitches, is every time you go through the skin with a stitch, a needle, or anything, it has the potential to leave a scar. So if you've ever seen scars that look like kind of railroad tracks where there's dots on the side, that's from the stitches that are going in. So you have to be really careful with those external stitches as to not leave more scarring. And that's why I prefer to do everything on the inside.
That makes sense. When you said that, it made me think of like my grandpa's back surgeries because he always had like the, and then those may have been staples too that got removed. I don't know.
Very much. Yeah, for sure. Yeah.
Yeah, I'm going to scroll up. Okay, so saline and silicone, I know we answered this, but which would look more natural?
So I think usually silicone implants look more natural.
Can you get a breast lift without implants?
Absolutely. And the neat thing about a breast lift without implants is there's something called an auto augmentation. And what that is, it's just kind of a fancy word for saying there in any lift, there's some breast tissue at the lower part of the breast that you have to do something with. You either have to remove it or you can actually keep it and reposition it on the upper part of the breast. And it acts kind of like a mini implant. It's not necessarily as big as an implant and it can't necessarily give as much shape as an implant, but it's a really neat little trick to do during a lift to add more fullness up here because otherwise, without that, the fullness at the top isn't going to really change.
So I've seen 2 of those in the past couple of weeks from Amelia, and I would have thought they had breast implants. And it was just the lift. It blew my mind how much repositioning breast tissue can just completely reshape the breast too. My mind was blown. I was like, are you sure this one doesn't have a breast implant? They're like, no, it's a lift. And I'm like, that's insane.
Yeah, it's a great technique because it's the person's own tissue, so they don't have an implant. And it's done with a lift, so that's great.
And we do things like Vectra 3D imaging. So if you don't know if you want to implant or if you just want to lift, we can show you a lift, implants, and both. Sure. So you can kind of see on your anatomy what you like the best.
Yeah.
So no MRIs for saline implants?
So the FDA recommendation to get imaging for implants is specific to silicone implants because what the FDA is getting at is they're trying to detect what's called silent ruptures, meaning you have a crack or hole in the shell and you don't know that you do. And they are saying you can get imaging to look for it. Now, a saline implant, if there's a rupture, you know it, so you don't need imaging to look for it. And that's what the FDA recommends. And then people can choose to do it or not to do it.
I don't know many people that honestly choose to do it, but I would like to watch it. So maybe I will get a breast MRI and show everybody what it looks like. Okay. Here's another one from Nutrition Plastic Surgery, who I'm interviewing tomorrow, by the way. She said, can you speak on implants in front of, behind the chest cavity? So I guess unders and overs, and
Muscle.
the ability to see lesions in mammograms.
Okay, sure. So implants over versus under the muscle. Most of the time I put implants under the muscle. There's a couple of important benefits to going under the muscle. One is on the top part of your chest. So having muscle on top of the implant, it helps with that transition from your chest wall to implant because there's more tissue on top of the implant. If the implant's on top of the muscle, there's just less on top of the implant. And it may make the implant a little more visible up there, which especially in somebody thin, potentially could be not a good thing. Also, implants under the muscle, I think, hold up a little bit better over time because the muscles help to hold up the implants. And then another really important thing is capsular contracture, which is an uncommon complication after having implants where the scar gets tight around the implants. The chance of that happening is a lot lower when the implant is under the muscle compared to above. So that's kind of the under versus over. As far as imaging, whether the implant is under the muscle or over, either way, it's under breast tissue. It's under the breast tissue. So either way, it's not going to interfere with imaging. There's a lot of good studies showing that having implants does not decrease the ability to detect breast cancer, increase somebody's chance of breast cancer. It's very safe and they can see everything they need to see.
Very cool. All right, let me scroll up. So excited for my consultation in June with you.
We are too.
Let's see. I thought there was one more that was kind of lengthy and I don't want to skip it. Lots of love to the best doctor. Best doctor in the world. All right. Required kind. MRI was, yeah. Thank you, Dr. Fredman. Getting ideal. I think we got them all. All right. And we're not going to answer Team Raleigh or Team St. Louis.
No.
We'll just leave that one.
Yeah.
Oh, we got one more. Okay, Destiny, you're the last one. Are complications like bottoming out or capsular contracture more common early on or years later? That's a good question.
That's a good question. In general, things are going to be more common years later. Bottoming out, if you think of it from happening from things relaxing and stretching over time, the more that's going to happen. Capsular contracture usually doesn't happen right away. It usually happens, within years out, and it can happen many years later too. Now, you do kind of think that with capsular contracture, if it hasn't happened after a few years, hopefully you're in this category of people that it's just not going to happen to because you're kind of safe in that regard. That's not necessarily a scientific answer, but I do think that makes sense, that once you're kind of a few years out, if you're good, you can feel okay about it. But yes, in general, the longer things go, things like rupture, capsular contracture, implant position problems, all those can increase over time. And
I like how Claire said, where are the sunglasses filter?
I don't know if I can put filters in.
Your sunglasses. You used that filter and answered questions the other day. All right. We actually have a couple more minutes. So we have 2 more questions. With the tummy tuck, how long does the pubic area stay swollen and why does it swell for some and not for others? Yeah,
it stays swollen for way too long. And it happens for 2 reasons. One is gravity. Right? Swelling just goes with gravity and that's where things go. The other reason it swells a lot there is the garments that you wear afterwards obviously need to be open there.
Yeah.
So you're not getting compression there. So without compression, you're going to swell more. But swelling is just something that happens there. Why do some people swell more than others? Again, it's just one of those things where some people swell more than others. It does depend on what's done there. Sometimes I do some liposuction in that area. That's going to make things swell a little bit more. So that can be a reason that somebody might swell a little more also.
I like that. And Colleen, at Amelia, we do not use numbing medications for a breast augmentation like Exparel, but we do use Exparel for a tummy tuck. Yeah.
And I just don't think it's really needed for implants in a lift. People do really well with the rapid recovery. People do well. With the tummy tuck, on the other hand, it is really helpful in helping people feel okay being up and walking around afterwards.
And isn't it more expensive for them to have the Exparel? Isn't it like kind of pricey?
Well, at Amelia, we don't charge people more for Exparel. It's just included with all tummy tucks.
Right.
But yes, it is an expensive medication for sure.
Okay.
Yeah.
And so what is considered a mommy makeover?
So mommy makeover is any combination of surgeries. It's just a general term, but it usually refers to some combination of breast and body surgery. Most often it's implants plus or minus a lift with a tummy tuck. In our practices, that's generally what it is.
Mm. And last question that I want to know, do you do BBLs?
Yeah, I do BBLs. BBLs are a fun surgery to get to do because it's there's a big artistic component to it, because a lot of it has to do with liposuction, sculpting to the areas around the butt, not just fat transfer.
So how much fat do you have to be able to remove for an average BBL? Is there like a certain amount, or is it mostly like shape?
Yeah, so I would say it's more based on the person's goals and their specific anatomy, because somebody may be a candidate for a BBL and we're really doing mostly liposuction and a little bit of fat transfer to the hips just to give a little bit more shape, whereas somebody else's goals may be to add a lot of volume, and then based on the person's goals, then it depends on what their anatomy is and do they have enough. Unfortunately, a lot of people don't, depending on what their goals are. So sometimes I do have to tell people, you're not a candidate for BBL because you don't have enough. It wouldn't be worthwhile to transfer. It wouldn't make enough of a difference.
Yeah, that's what I was told. Just throw that out there. They were like, you don't have enough fat to suck out. And I'm like, okay, well, can I gain weight? Is that a thing? Do people gain weight for a BBL?
Yeah, you can gain weight for a BBL, but the fat that's transferred when you lose weight is going to shrink also. Yes. So you have to consider that if somebody gains weight, does the BBL, and then go back to your weight, that fat's going to go down too.
It's just not in the cards for me, I guess. All right, Dr. Fredman, that's all the questions we have, and that's all the ones that I believe we got to. So I thank you so much for doing this. I know a lot of the ladies really appreciate you giving your time. And I'm so glad that you're in Raleigh right now, selfishly. But we're going to do this monthly, so I will see you next month with more questions. And so you guys, if you don't know, Dr. Fredman is in our Bustmob Ask a Surgeon group. So you can get in there, ask him questions, follow his Instagram, see his before and afters, all the things. So thank you again, Dr. Fredman. I really appreciate your time.
Thank you so much. It's great being here.
Bye.
Bye.